Many children born at health facilities and in the community were not being referred for management of those disabilities because many people used to attach very many things, myths and misconceptions are attached so much on child disability.
Some of the staff, before the project started, had the same thinking like the community, that children born with disabilities, there must be a problem somewhere.
Kale bajja naye bwe bajjanga era nga tubalabanga abalala nga tetufaayo oluusi kubateekako nnyo birowoozo.
We had those children who were being born with disability, especially the newborns, but we could refer them to other facilities like Mulago because we could not manage them, despite of being with the physiotherapy here.
There is a way health issues disproportionately affect women and young children. But uniquely, the component of children who are born but with birth defects became a major issue.
This mother has faced a lot of stigma from the village people, the community, because all mothers used to laugh at her baby.
Nasinga kifunanga kuba neyimba omutulugunya ekyana ne mwana maga mwana muleke nenze nakala ningayuka omwana ngina muliza nta.
Twagezaako okunoonya ku buyambi kubanga amasomero agasomesa abaana abo si ge mangi ennyo.
Naye nga ye omwana we yaweza emyezi 2 agenda okulaba omwana tandika omujjira n'olugalo lwoluno genda omuyisa mbwoti naye nga tolaba walukola ki wakyuka ate ng'omwana tandika mu myezi 2 omwana batandika okuba nga alaba naye ye tabikola.
Tusonose nitugendako emulago eyo yaaba emulago bamugambira ekyo mugamba gulayika mutima naye nti mujja kudda tuddayo dokita tetwakola ki
This project was set out to increase first and fourth ANCs, to also increase postnatal attendances and at all facilities across the 4 districts. It was also set out to increase skilled birth attendancy, to also increase early identification and referral of children with disabilities.
They taught us the causes, like how to identify the disabilities, the causes, how to manage them, the myths, the concept that the community has about some of the disabilities.
So they are very critical at the assessment of the newborn to rule out or to check out for any disability which could be coming along with the newborn. So this one helps for early interventions, and it is good for us to ensure that the children who are born, yearly we identify them early enough and then correction can be instituted.
When this project came in, mothers came in with children with disabilities, and there are many out there in the villages. The Safe Motherhood Project has actually built capacity for health workers. Those are the midwives and also the VHTs.
Right now, I'm able to move in any community, talking to mothers. So, Mildmay Uganda, and we had even other type of disabilities we didn't know. Right now, we are able to do what? To identify them.
Here in Kasana, specifically, when we deliver those mothers of spinal bifidus, specifically we refer to also those mothers who are able to go. Because some you can deliver and they tell you, "Misao, I cannot afford to go. Tell me how I can live with this baby." So, as a midwife now, I have to counsel this mother so that he find ways of going to be helped. Those of hydrocephalus, we refer them to Mbale. We can manage those babies with bow legs.
If any child is identified from any health center and is referred to Koshu, that child is received with wide hands. And the parents who used to find problems taking their children to such facilities now or centers, they're finding it very easy because there is a network.
When children are identified with the club foot or any other foot abnormality, they are referred to us, and I'm one also who are involved in treating them. Also training other orthopedic officers in treating that condition which we have called the club foot.
For the financial 2017-18, 45 birth defects were reported. For 2018-19, we had 32 birth defects. For 2019-20, we had 45 birth defects. However, with the Safe Motherhood project has really supported facilities to report this, because used to have a challenge. Actually, many of them would ignore this indicator. It would come blank. Safe Motherhood project has built the capacity of health workers to identify the defects, refer them, and also manage data around these indicators.
Targeting the children with birth defects, the entry point is safe motherhood. You ensure that the mother is ready to get pregnant, to have a child, support the mother to have a health pregnancy period, support the mother to deliver under skilled health personnel in a hospital, health facility, whether private or public, depending on their choice and ability, and ensuring that the health workers are skilled to quickly detect birth defects and intervene.
Bwe twamala ofuna training eyo twakomawo mu bakyala ne tubayigiriza okulabirira abaana abo kati babalabirira bulungi era balina family group support group naye bakuŋŋaana wano.
In the 4 districts, 41 family support groups are running, and in these family support groups, those mothers meet. Our objectives are also met during that family support group. For example, antenatal is offered during that family support group in case there is a pregnant mother, but also has a child with disabilities. Is also given antenatal services.
Mbutufu tubasiima nnyo nga wenkomeza. Kubanga bannange abamu tubadde tetubamanyi. Ate nga n'abamu tebakola ki? Tebatumanyi. Ng'ate n'abamu baggwamudde essuubi nti abaana be baazaala tebalina mugaso. Naye bwe twekuŋŋaanyiza wano ng'abazadde, ono bw'alaba kuwooli ng'ate naye afuna essanyu. Kati bonna bagumu we bali tebakyennyamidde nga mu kusooka. Ne tubasiima nnyo neera okuddamu okutuwa omulimo gw'omu mutwe ogwa sabbuuni. Kubanga mu butuufu ya sabbuuni tukola ate tukyenyumirizaamu nnyo omulimu gwaffe ogwo nnyo.
Tukola n'akatale outside the facility mu tawuni ezirinaanyeemu like Woblenzi, Bombo 21, Kalule. Kati sabbuuni oyo bwe bamugula sente ezo bazisevinga mu group yaabwe mu saving group, kuba tulina saving group eya child disability. Kati abaali basavinganga 2,000 osanga nga asavinga n'5,000 a week.
We've raised awareness from grassroots to the district, and we hope to see mainstreaming of childhood disability prevention, intervention, early detection in district work plans. Now, going forward in our follow-on projects, one will continue with capacity building. We want to see that as many health workers as possible have the skills, necessary skills and knowledge to identify, prevent, refer, manage when as appropriate. But we also want to strengthen our socio-economic empowerment aspect. We believe if mothers or families are economically empowered, they're more likely to access health services. They are more likely to feed their children better. They are more likely to advocate even for their own rights where those are being abused as a result of disability.
We are so glad and happy because they have really brought a smile to those children who had disabilities and who still have them. And we hope that those who are still having them will also get better lives. So that's why we are asking for inclusion of treatment subsidy for these children, so that in the next phase it is included, and we bring smiles to all those children who are still behind because of transport challenges.
The project we are talking about has been so good that it has unearthed so many things that have been available in our communities. So I'm requesting the donor. 2 years has been so short a period. In fact, I was thinking of if we can have a successor project to this project so that we are able to follow up what has been started.